So, welcome everyone. Today we're going to talk about questions that we hear all the time. So, why do I suddenly have anxiety or poor sleep or brain fog when I've never struggled like this before? We're going to talk about what's happening biologically. So, why so many women are prescribed SSRIs during perimenopause, and then understanding how both hormones and mental health can help women get there. Amy, would you like to introduce yourself for a minute?
Sure, yeah. Happy to do that. My name is Amy. I'm the CEO and founder of Oova. I am a scientist by training, so I have a PhD in biomedical sciences focusing on genetics and genomics. But I'm actually a trained data scientist. I worked in industry for about 7 years before I pivoted to start Oova. Just in a quick nutshell, Oova is an at-home hormone testing platform, and we currently help women navigate fertility, perimenopause, hormonal imbalances, or really anything that has an underlying hormonal condition.
Thank you so much. And for those who don't know, I'm Amy Green. I am the Chief Growth Officer and founder of Mamaya Health. We are a women's mental health company from period through menopause, supporting women with access to care. And we recently partnered with Oova. We're extremely excited about this partnership because we really do understand that perimenopause and menopause in particular are seasons where women have significant challenges with their mental health symptoms, but that there is an underlying biological component to that. And so if we only treat one and we don't have the information for the other, then we're really missing the boat as to how we can be supportive and empower women to understand what's happening in their body and then how they can get support around it. So that's what Amy and my conversation is today. So before we talk about mental health, can you explain, Amy, what's actually happening hormonally during perimenopause for us?
Yeah, sure. So if you think about women's health overall, right, we have menstrual cycles for the most part, assuming that we haven't had a hysterectomy or any other surgery to prevent that. We are supposed to have menstrual cycles, and they're driven by a hormonal balance, right? So these hormones that we're always talking about, estrogen, progesterone, luteinizing hormone, FSH, they all work in this synergy together to help us progress through the menstrual cycle, right? Now, what happens is if one of those hormones kind of gets imbalanced or goes out of whack, it has a downstream effect on all of the other conditions. And then that leads to a lot of symptoms. So, by definition, perimenopause is that period before menopause. Menopause is a moment in time. It is the day you have gone 365 days without a period, and your anything after that is postmenopause. Anything before that is perimenopause. So, what happens during perimenopause is that our hormones get a little imbalanced, and that's what starts to send things into haywire. We start to experience a lot of symptoms. Many of them are quite under discussed, which I'm sure we're going to be talking about a lot today. But the real big thing is that your estrogen and your progesterone start to become really unpredictable. And until you can kind of get a sense of what they're trying to tell us, it becomes quite difficult. It can become quite difficult to manage. And unfortunately, perimenopause can last anywhere from 7 to 10 years. So we're not talking about something you can just kind of sweep under the rug and deal with at some other point. It ends up really taking over a big chunk of your life.
So it's not surprising that we suddenly all out of nowhere develop anxiety or anxiety symptoms, right?
Not at all. I mean, these hormones, they do influence our serotonin, our dopamine, GABA receptors, sleep, everything. We actually ran a survey last year where we asked women that were navigating perimenopause what the most common symptoms were that impacted their life the most, right? And when you think of perimenopause, you often think like hot flashes, night sweats, that's what's discussed the most. But actually, anxiety, mood changes, and sleep disturbances were in the top five symptoms that women were reporting. And the night sweats and hot flashes were also mentioned, but they were all the way at the bottom of the list. So, what that tells us is that the most debilitating symptoms are often not associated with perimenopause and are, more importantly, often misdiagnosed.
Yeah. The roller coaster ride that when I was recording the shift, I was talking through the hormone changes and just I kept thinking of a roller coaster because I was like, that's really what you're on. You're on a
Yeah.
journey where like one hormone's tanking, it's going to tank the other one at the same time. And then it comes back and then you feel fine for 2 seconds and your sleep normalizes again. And then it's off the deep end again. And it can be a wild journey and ride without a lot of support.
Yeah, so you imagine a roller coaster where it's kind of in a loop because you are still technically cycling, it's just irregular. But then somebody, some person in the Hunger Games board, is like dropping in a new hill or a new loop. in that roller coaster. So the next time you go through that loop or that cycle, it's slightly different. And you have no way of knowing or being able to predict necessarily what that new event is going to be. So, really understanding what your baseline is and then figuring out what's changing from that baseline is so critical to helping you navigate this journey.
That makes so much sense. So I think, when I think of women who are navigating this, I hear women talk about like, I've never had this anxiety before, or I don't feel like myself, or I'm just exhausted, like bone dead, tired, or they can't sleep, or they think they're losing their mind. And when they say things like that, I mean, with what you're describing, Amy, it makes perfect sense, right? So when we talk about postpartum, we talk about this trifecta. We had a baby, we had a hormonal crash, we have no sleep because the baby is constantly waking up, right? When I think of perimenopause, it's a similar type of trifecta. We have, again, another really significant hormone event going on without a lack of sleep. And I think that one of the most kind of jarring changes is, this lack of buffer. When we talk in yoga, we talk about having the space between, right? This like space between my decision and my action. And you can pause and take a breath, and that's great. And oftentimes with perimenopause, that like buffer space gets reduced significantly. And so that irritability or that kind of fire that comes up makes you feel like you're
Yeah,
just reacting. And that emotional buffer that we used to have that we're like, oh, that's okay. Or, oh, I can tolerate this a little bit more. It's just gone. And so we find ourselves being irritable and flipping out and losing our mind with
yeah,
people that we love and care about in situations that we never thought we would lose our mind in. And it can have a profound impact. And then you add lack of sleep on top of that, and how much more irritable are we, right? It all makes sense
100%.
when you put it together.
Yeah, absolutely. I mean, I guess like when you, because you're seeing patients every day that are coming in for various types of therapy, what is the most common thing that they're reporting?
I think that they just don't feel like themselves anymore, and that they're very
Hmm.
disoriented because the way that they're used to operating, or the way that they're used to, whether it's, the way that they're used to eating or being able to lose weight, or the way that they're, able to manage their emotions, the things that worked before just don't work anymore. And so there's this really big disorientation of, who am I now? What is my body doing? How do I understand myself? And then how do I try to find a pathway forward? I mean, even things, Amy, like the way that I used to enjoy sex, right? Which is very taboo to talk about, but genuinely happens here as
Yeah,
well. Um, those things change significantly. And so, how I understand myself, who I was before, and then who I'm becoming, we are in this to 7 to 10 year process of, kind of unraveling who we understood ourselves to be, and grieving her and being mad
exactly.
on, and
Yeah,
trying at the same time to lean in and be curious and try to get excited about who I'm becoming
yeah,
in the middle of
yeah.
what feels like chaos.
I saw this great meme of somebody like who was navigating perimenopause, and it was so funny because she's like, I am mourning the person I was up until today and really excited about who I'm about to become. And so it was like this phoenix moment,
Yeah.
right?
Oh,
That she was trying to
absolutely.
position it as. And I'm like, that's
If you
actually
can
really
hold on.
interesting because exactly that's the key thing. How do you hold on to it?
Like,
But given all that,
yeah, and getting
go ahead.
excited about what I don't know I'm going to be, right? I think that that's like a hard thing too. Like, how I don't know what I don't know about what this next season of who I am. And so it's hard to feel excited about something you don't know or can't define yet?
Exactly. Totally get it. And it is hard to lose sight of that goal as we're navigating this.
Yeah.
Given that, like, I'm glad that we're talking about how you're kind of ending up having to mourn yourself and being aware of this, right? Of this new rebirth of your own self. But why do you think so many women end up on SSRIs during this phase?
I think because I mean, so many of the reasons that we just talked about, Amy, right? The hormones, when they shift, I mean, progesterone and estrogen impact your GABA receptor significantly. And so when you aren't able to produce the same type of input to these very important hormones for our brains that feed our brains, nourish our brains, nurture our brains, but also give us that calming sensation, that smoothing sensation. They help to make us, again, have that buffer room in that space. You know, I think of an SSRI as almost that bridge kind of holding our hand as we get through the season to get to the other side, so that we feel a bit um more access to our coping skills or to regulation. SSRIs are a tool. They don't have to be the only tool. They're one of the tools. And, I think that they're a profound tool, especially if you're finding yourself having a ton of anxiety that is keeping you up in the middle of the night, these intrusive thoughts that just stay on loop or on repeat, being able to get out of that depression. When we lose testosterone during the season, we can lack motivation. We can lack that drive or that, like, kind of interest in anything. And so those things can mirror true anxiety and depression symptoms. And so that's where SSRIs can be such a help here. At the same time, so can other tools.
Yeah, absolutely. And it can kind of be a launch pad, right? Like, let's get things kind of under control, and then we'll start to wean ourselves off of this and
Yep.
see what other changes I can make that I control to finally get, like, I guess, get back in the driver's seat of this journey.
Yeah, I think, again, I feel like it's one of the tools that can just hold your hand while you walk across the bridge, and at the other side of the bridge, it might not be needed anymore. I think what can be so powerful about it though is that, you know, to have access to myself and to try to get myself to understand and feel excited about this next person that I'm becoming, I might need that support. And the other thing too, Amy, that I hear women just talk about all the time is that, they just are scared to ask for help or don't want to ask for help, or they got it. They can just like push through. And if I just push through a little bit more. And I think this is one of the seasons where pushing through it really does a disservice to us. It can actually be really harmful to us to push through because our hormones are going through so many changes and we deserve support. And so, the invitation I think in this season is to speak our truth, whether we want to or not. It kind of comes out for better, for worse. But I think in addition to that, it's also where can I find support or where can I be supported as I go through this transition, and how do I need to invite that in? That could be, again, an SSRI. That could be an honest conversation with my partner about what our sex life needs to look like during this season. It could be an honest conversation with the support people in my life saying, you know what, I actually need a hell of a lot more help with my kids or my work or my whatever so that I can do it. It could be, coming up with new strategies and skills to try to remember things and write things down and make to-do lists because my brain is just not the same brain.
Totally. Yeah, it makes so much sense. And I hope that we can actually give ourselves that grace to listen to what our body needs and actually give it that attention.
I feel like we operate in such a self-individualized society where we just don't rely or turn to each other for things as much as we should or could. And it's I think what makes it sometimes a really lonely season too. Similar to, again, like postpartum, like you can stay inside and you can isolate and you can be in a lot of pain. And again, that grief and that anger over losing that woman that I was. But again, it's every single woman is going to go through this transition at some point in their life. And so if we
Exactly.
normalize it and talk about it, and not just talk about, I, I joke a lot with our team because I read these threads posts, and perimenopause is everywhere on these things
Hmm.
because women are trying to understand their symptoms and they're trying to understand their bodies. And I love it. I adore it because the way that these women show up and are like, hey guys, I have itchy ears. What is happening? They're like, girl, let me put you onto something. Let me tell you about the itchy ears and perimenopause and the other millions of symptoms that, it's a joy. They, find a way to, again, come together. But I think that if strangers can do that, how can we invite that in with our closer relationships, right? I think we deserve.
Totally. I completely agree. I completely agree with you on that.
So, Amy, if hormones are causing these symptoms, why are so many women told that hormone tests are normal? Because that's really confusing.
Yeah, 100%. And I mean, it kind of makes sense, right? If you look at what the guidelines currently say for perimenopause, they don't really rely much on hormones. But why is that? You're talking about making a decision or drawing a line of treatment from a single snapshot measurement that you get from blood work. Unfortunately, as we've been talking about, these hormones are fluctuating. You really can't see those changes that are happening from a single blood draw. You need to be able to see how these hormones behave in a trend or on a daily basis. And so with something like Oova, we do test these hormones every day and we are able to see that imbalance. You can see how your estrogen and your progesterone are behaving day to day. And that imbalance is so critical to understanding, did I experience a symptom or not? Is it in my follicular phase? Is it in my luteal phase? Is it like you get to start to uncover and peel this onion back quite nicely with every additional piece of data that we capture. And the other thing to keep in mind is that perimenopause isn't just one thing, it's a pattern. There's a series of symptoms that are coming out, and they're not all driven by the same underlying hormonal condition. So, as we're navigating this 7 to 10 year journey, what you experience on day one is not what you're going to experience on year 10. It's going to change. And we need to understand how our hormones are really underlying that and what those changes are driving. So there's a big missing component when it comes to hormonal like behavior and perimenopause, because there's a massive gap when it comes to longitudinal hormone understanding. And that's what we're trying to fill right now.
Tell me more about that, because that is
Mhm.
something that blew my mind when I was on stage, I think a year or two ago at Women's Health Horizons conference. I learned about the gap in menopause and perimenopause research and tracking in our data. Can you tell us about that for a second, Amy?
Yeah, absolutely. It's sad, but it also kind of makes sense once you understand this component. So like now keep in mind, I am a researcher, so I understand setting up a study and how you want to make sure you get the best outcome at the end of it, right? So when you're thinking about doing a women's health study, you are going to try to remove any outliers, right? So you are going to try to find women that have a 28-day cycle, that aren't going through menopause, that still have a uterus, that still have their ovaries, like try to make this the best patient pool so that you can get clean results. Well, the problem is when you're in perimenopause, you don't have a 28-day cycle. Your cycles are by definition irregular, and you are going through a transition. Post menopause, you no longer have a cycle. So, in both those cases, you're most likely going to be excluded from any of the women's health research that's happening. And that's why we have such little data when it comes to perimenopause. And what I find really exciting, though, is when we look at Oova's data, because now we have a massive amount of perimenopause hormonal trends that we can look at. No matter how, like, my happy place is going into our data set and seeing like what can we find. And it's exciting but sad that no matter what we find, it's groundbreaking because no one has been able to look at data like this before. And so we're starting to see how can we actually educate consumers and then also clinicians on the findings that we're having. So seeing very clear patterns when it comes to your estrogen behavior and sleep quality. Now I know we have this partnership with Aura, which is wonderful, and we're able to get this objective sleep data, which I think is going to be game changing for the industry. You're not looking at how many hours I'm saying I slept. My device is telling me this. We can trust it a little bit more. And I think we're going to start to really uncover some meaningful hormonal underlying patterns that are going to inform what symptoms women are experiencing. And then hopefully we can close that data gap too.
It's the coolest thing ever. I'm like, I was literally, I was trying so hard to not have the reaction on stage because I was just like, you are not here to have this response. But I was like, what do you mean we have never tracked menopause in data sets for women? And then we've prescribed medications and
Mhm.
we made all these decisions for women and their bodies and all we again, God, I mean, Alzheimer's medications, diabetes medications, GLP-1s, none of them have any sort of menopause data set to it. So we don't know if
Um,
the dosage is right. We don't know how it impacts um, based on the time of the month or in menopause, no time of the month, right? It's just
exactly.
pretty profound information to not have when again as a person living in a woman's body I understand that there's different things that happen and could impact me differently. So um yeah, that's it's just mind blowing. I'm so grateful
Right.
for the work that you guys are doing and the research you're doing because it matters so much to be able to um and it's so it's so sad at the same time it's so exciting to say it's so profound, right? Like it's
Yeah,
groundbreaking because
it
here
is.
we have and this is the pathway towards what again in the future is personalized medicine, right?
But it has to start somewhere, right? So we can either sit here in the dark hole and be like, oh, there's no research out there, no one's doing any work. Well, that's not true. People are trying to do the work. It just takes time. There's
Yes.
always going to be more research about ED than there is about perimenopause. Accept it. Let's start to fuel it and put more people in the research space to have more papers and research on perimenopause. That's my ask for the industry right now. That if you're doing the work, like put the data out there and let's get some new findings to help move this field along. Um, Amy, you said something really interesting, like how we do start to not feel like ourselves, and you end up becoming somebody new. And as I mentioned, like one of the more common symptoms that women are experiencing is anxiety. Now, what if someone discovers or accepts that they're starting to experience anxiety in their 40s? What would be one of the first things that they should do?
So, I mean, this is where I think again, like the therapy or even just some of the mindfulness practices can come into play. So, even just starting with again, trying to find ways to create that space, to create that muscle in a time period and time season when it can just feel impossible to have that space between to make the choice so that you feel empowered about how you want to respond versus feeling reactive to something, right? So, calming your body down, giving your body time to rest. I think one of the most interesting things again is like our workplaces and our society is built on this 9 to 5 rhythm. And a 9 to 5 rhythm may not be a woman's internal rhythm or need for that season. And so where are there ways that we can invite in? Again, if I'm not sleeping from 3 to 6 in the morning, guess what? I need more sleep. And it might be from 6 to 10. And so, where can I invite in? And is there an opportunity to look at and invite in a different season and a different rhythm within my workday, within my, my life of just when am I working out? When am I moving? When am I eating? When am I sleeping? When am I going to be awake? Even if it's
Yeah,
from 3 to 6 in the morning. And how can I be supporting myself with that, knowing that this is, again, a season I'm going to be in for some time. Um, then again, when I come back to therapy, therapists are an incredible resource, especially CBT and CBTI. So cognitive behavioral therapy for insomnia it's a tool, and it's a very well researched, evidence based tool that can be such a powerful kind of reset to how and when we sleep, and just trying to get our body back regulated over and over again.
right.
It also helps us to, I think, get out of some of the patterns that can, like Pavlov's dog theory. So, like, he talks about how he had a clicker, and every time he clicked the clicker, he would give the dog a treat. And he clicked the clicker and give the dog a
Hmm.
treat. And at some point, the dog just knew if the clicker, he was already drooling, if he clicked the clicker, he wasn't getting a treat, right? We can do the same thing to ourselves and train ourselves bad habits, such as I'm going to be awake and I'm going to be in my bed. And that can actually cause us harm over time, because then we can start to associate the bed with a place that we don't sleep, just like the dog associated the click with a treat. And so CBTI really works on how can I change my habits up, or how can I kind of force myself to not associate this one place that has to be for sleeping with a place that I don't sleep. And so, whether that's getting up and out of bed and going and reading a book, or again, listening to a guided meditation in the middle of the night, or just again, finding something to do. I mean, if you're wide awake and you want to
Why
move,
not?
right? But I think it's a kind of scripted program and protocol that can help people to get out of that and reset that association, which can be such a powerful tool. And CBT works similarly. So with anxiety, it's how do my thoughts affect what I do and what I feel? And there's ways that we can, and there's lots and lots of tools within that toolkit to that therapists can bring to the table and work on the individual with. But it's, how do I challenge an intrusive thought, or how do I stop a worry cycle or a negative thought cycle? How do I, work with myself to find more self-compassion? That's a big practice. There's an amazing researcher, Dr. Neff, in the field who does self-compassion research. And how do I have compassion with myself in this season when I just, again, feel so out of control? Being able to process the grief, I think, is a really healthy and valid thing. And oftentimes we don't really give ourselves, especially in American culture, a lot of space and time to
Yeah,
grieve and to be mad about it.
100%.
Where can we be held, and who can witness that? And I think that, that's the privilege of the role as a clinician, is to be able to be somebody's witness to that.
Right. Oh, that's great. I mean, I think that's one of the toughest things, right? Giving yourself that grace to be able to actually go through these motions, and then also being able to like accept that this is happening to me.
Yeah, getting to that acceptance place can be challenging sometimes. And so again, I mean, I think the journey to it is is oftentimes how can I work through the feelings that prevent me from getting to acceptance. Radical acceptance might be a concept more than actual genuine acceptance. But you know, I think that there's a lot of worthiness, and I mean, God, we deserve support through this. And
Absolutely.
I think what makes me, excuse me, so excited, Amy, is that if this is what if these are the conversations we're having now, and these are the tools and things that are coming together now for women who are going through perimenopause in 2026, what does it look like in 2036, right? What does it look like in
Yeah.
2046? It just becomes such a different game. So
Yeah. We're creating the wheel. Like we have to be pushing this forward.
absolutely. So what does it look like, and what should women do on the hormone side then, Amy?
Well, I think one of the things that we touched on is that one of the biggest complaints that women experience is they don't feel like themselves. That's a really hard thing to walk into your doctor's office and be like, I don't feel like myself. The doctor's not going to know how to treat that,
And now what?
right? There's no like CPT code for them to use to help figure out what that protocol should be. So what we're trying to do is how do we provide you as the patient with enough resources to be able to go into your doctor's office and have a two-way conversation and be able to speak the language that a doctor can actually understand and then more importantly treat. So you don't feel like yourself, great. Let's start to track those symptoms. Let's see when those are happening and not just be like, okay, let me give you the mode of all of my symptoms. I have trouble sleeping. Well, when are you actually having trouble sleeping? Is it in your luteal phase? Is it in your follicular phase? Is it when your estrogen is dropping? What is it? Because those are all things that can be treated if we can pinpoint it. So, what I would recommend is that you start tracking your symptoms. You also track your hormone patterns on top of that, because now you're starting to get something objective. Doctors understand hormones. They know what they do, what they are supposed to do, and it's not a foreign language to them. So now if you're marrying those symptoms with the hormone patterns, all of a sudden you're bringing something really objective that a clinician can understand and then more importantly use to figure out a personalized treatment protocol for you. And the solution isn't always just jump into HRT. It could be. It's a very valid solution, but there are other interventions like we were just touching on that are appropriate, and you can have a really meaningful discussion with your doctor to see what is the right path for you, what are the concerns that you have, and then make sure you get on the right treatment protocol for yourself.
That's amazing. I think it's such a powerful, like having the information and being able to take the information and data to actually say this is what's going on is such a different conversation than what you said. It's just, I
I
just don't
know.
feel like me. I'm snapping at my husband. I don't know.
Yeah, it's really hard, and like I'm feeling like I'm sure I'm going through perimenopause right now, but like my patients, like I don't think you've ever irritated me as much as you are right now. And I think overall we were a pretty happy marriage. And I'm like, I just don't want to be around you. So
The
it's
sameness
it's
isn't there.
really an
It's just gone. The buffer, it's gone.
yeah, going for a walk is actually quite a good solution to help with not only your mental health but also with your marriage. I'll be honest.
Relationship advice. Just go on a walk.
Just go on a walk.
I love that so much, Amy. Um, it's too real. Why did coming to our partnership, because I'm just so stoked to talk through this with you. Why did Oova and Mamaya decide to work together? I'd love to hear your perspective, and I'm happy to share mine too.
Yeah, I mean, I think, and this really shines in perimenopause, but like honestly, it's not limited to just perimenopause. It's really all stages or seasons. I love how you call it a season of life, of seasons that we go through as women. But our hormonal experience and these different phases are not separate from our mental health. They are very much intertwined. We know that there's a hormonal signal that drives anxiety, that drives sleep disturbances, that drives all these other things that ultimately can get you on a treatment course that may not be the right thing if you don't give your mental health the appropriate attention that it needs. So to me, this was like a hand in hand. We need to like work together. This was not a tough decision to make at all.
Yeah, I think that when I first off, I love your product. I'm obsessed. I think that tracking and the ability to track hormones, again, I mean, I have an Aura ring on, like I like data. I'm a bit of a dork. It's fine. Um, but the ability to track data about your cycle, and you know, I think I started perimenopause when I was going through postpartum with my youngest, which was just a
Yeah.
fun journey. And I don't think I could pinpoint what exactly was happening, but I knew something felt different.
Yep.
Um, and so, I think again to where do we notice the hormone changes? Where do we notice how that then impacts our emotional and mental health? And the intersection of those is so fascinating. And we don't understand a ton about it yet, which I think is what I'm so excited about, because this then gives us access to data that can help us to understand when I'm feeling sad, when I'm feeling mad, when I'm feeling more irritable, why those things are happening versus just I'm anxious and I have no idea what's going on, right? I think the other thing that is so powerful is that if we can track things back to cycles as much as we cycle in perimenopause, as if we can track it back to a rhythm, then it's not something that's a diagnosis. Then it's not something we're stigmatizing ourselves with, or we're making this hard label, I'm just a depressed person. When in fact it's, I'm experiencing this hormone drop. And when this hormone drop happens,
Yep.
I experience depression. It's a very different way of talking to ourselves about our mental health symptoms. And I think that space from the diagnosis is really helpful.
Oh, absolutely. I mean, I like to say that we're just really adding color or translating what our body's trying to tell us into a language that we can understand.
Yeah.
Because sometimes the headaches don't really convey what's going on.
No, they don't. No, they're just debilitating and annoying.
Yes, absolutely. Amy, I don't know if we got any questions or anything from folks that tuned in.
I'll go and check right now. Let's see. Go back into the LinkedIn space. Thank you, everybody who has joined. You can see that there's some folks on here, which is really cool. I'm getting there, guys, I promise.
And Amy, I think we have a landing page that people can go to learn more about our partnership as well, right?
Absolutely, yeah. I can post it in the comments here. I don't see any questions yet. If anybody does have questions and want to put them into the comment section, we'd be happy to talk through those. I think, when I think about the ability to be able to tie, again, my emotional symptoms or experience back to our hormones, Amy, I think about um, this, again, whether it's like a rhythm or a cycle or even just a one-time experience, but I understand and can tie it back to that. And that's the same thing that I'm excited about with Aura too, is how does the sleep data and HRT data and how do all these pieces tie together? Because we're not siloed things. We are not
Yeah,
siloed experiences. My body is not separate from my brain,
right,
and
exactly.
it shouldn't be treated as separate. And I think that when partnerships like this exist, it brings that whole woman together and it brings the context to why she is experiencing what she's experiencing, when she's experiencing it. She can be empowered with that data and information so that she can then make decisions about what type of support she needs or when she doesn't need to be doing X, Y, and Z thing, because I know that that's coming up and that's not going to be the
Yeah,
time to have a lot of patients, or I'm going to be feeling more anxious or my sleep's going to go off the deep end, right? What a different world
absolutely.
it could be.
100%. It's really about putting you back in the driver's seat of your own health. And I mean, I know when I was going through my own hormonal journeys, I didn't have the data or the wherewithal to advocate for myself. I was really at the mercy of my clinical team telling me what I had to do, what treatments I had to go on, and I was put on medications I didn't need to be on for an extended period of time. And so being able to have data to not even, it's not to be combative, it's really to be able to ask empowered questions and make sure that whatever plan you're being put on, you are on board with as well. And it's not just like, my doctor told me to do it, I'm blindly going to do this because nothing can be worse than what I feel like right now.
Yeah, I think it's so needed to be able to understand again, why am I making what decision I'm making and how is that evidenced in or going to be supportive for whatever it is actually showing up in my body and my symptoms in my brain
Yeah,
and not again
absolutely.
that are siloed. I think there's also a lot to say, Amy, too, about the fact that like if I choose to make a decision about an SSRI or a different medication to go on, how does that then impact these other things? I think, again, because perimenopause is such a sensitive season as far as hormonal balancing, there are other things that can impact our ability to balance our hormones well. And so
Exactly.
if I start taking these interventions not fully informed about how it impacts the baseline, that also can be really impactful too.
Yep. Totally agree with that.
What would your goal be, Amy? Like if 5 years from now you look forward, um, and Oova and Mamaya have done great work together, what would you like to see the outcome of that for women?
I would love for a woman to be able to not feel shame talking about her mental health. I feel like something is drastically wrong with her. And instead, it's like kind of like what you were hinting at, that if my hormones are doing X, then I know I'm going to be feeling anxious in this time. So let me take the right steps. And we have worked together enough to say, like, this is the protocol for a woman who has a hormone pattern like this, experiencing symptoms like you're reporting. And we have seen that this actually works for you because you feel better. So I would love to get to that personalized level where it's it doesn't always have to end in a therapeutic. It can end with a lot of things that a woman can do on her own, as long as she knows when to do it and how to do it right. And so I do believe we can get to a world where we can really help women navigate that personalized mental health care based on objective data.
I couldn't agree more. The goal, I think, Amy, is in choosing between therapy or hormone insights. I think the goal of our partnership is giving women a more complete understanding of what's
Oh, yeah.
happening so that they can get the right support for them, which I think is just so powerful. And I'm so grateful for your partnership. It's incredible.
No, thank you. It's not an or statement, it's an and. It needs to exist together.